In this session, as usual, we'll be looking at some clinical tips on how you would use these medicines in cardiovascular conditions. In conditions relating to the heart, it is of absolute paramount importance that the specialist, the appropriate specialist, is involved throughout the homeopathic treatment. And if it's an acute case, it needs to be referred to the A&E department. Okay, and only a trained physician should offer advice regarding cardiac conditions. Please keep this in mind. So, why are we studying this? Because we do get patients who want homeopathic treatment, who are already gone through the acute phase, who have gone to their cardiologist and they've been prescribed conventional medication for their cardiac condition. And they come to homeopaths as a support and also to see whether there could be some kind of a reduction in the number or amount of drugs that they are on. Now, all we can do as homeopaths and CAM practitioners is to start the treatment, giving them homeopathic treatment, and as you see the changes in the patient, you need to advise them to go back to their specialist. It is the responsibility or duty of the specialist to review the case and either change or taper or not do anything at all. We cannot stop or advise any changes to their prescribed medication. And remember that it doesn't mean that because they are on conventional or allopathic medication that they cannot see any results taking homeopathic medicine concurrently. Yeah, we can see a difference in that. The other things that we could advise is about diet, exercise, and of course stress management. These are very important in the management of any heart conditions. And if you've got enough knowledge, you could also advise them of vitamins. Yeah, vitamin E and C are said to be a good supplementary product for cardiac conditions. Also levels of calcium and magnesium. Maybe advise them about flaxseed oil or omega fatty acids, garlic, lecithin, CoQ10, and also about cholesterol lowering substances. So there is the one aspect is prescription of the homeopathic medicine. The other might be either advice if you are, if you have the knowledge, or refer them on to a dietitian who can advise them about the diet and other supplements that they can take. One thing in homeopathic literature and in homeopathy, practice of homeopathy, is we do not base our prescriptions on the names of conditions, and therefore angina and myocardial infarction as treated as one and the same, because the symptoms, we just base it on the symptoms, so we don't differentiate between angina and myocardial infarction. In such conditions, it's usually preferable to choose a remedy which is a lower potency, around the 30 Cs, so that you do not bring about an aggravation when you use a 200 C. If it is a patient who is already past the acute phase, then maybe according to Roger Morrison, the homeopathic potency which he advises is to start with a 200C and then go on, followed by a daily dose of a 12C. Or consider going into the Q potencies or LM potencies. More than cardiac per se, like angina or myocardial infarction or anything else, what we would see quite often is patients coming to a homeopath for their treatment of hemorrhoids. And homeopathic treatment works very well, and even during the acute stages you can see a rapid relief of symptoms when homeopathic medicines are prescribed. And again, homeopathic medicines chosen based on the law of similars. Now, in addition to choosing and giving a homeopathic remedy, you can give them some common generalized advice, and one of them is strict local hygiene. 2, their diet, to avoid spices, strong spices and alcohol. And the food needs to be light with plenty of water, and of course you also need moderate exercise, especially in conditions of hemorrhoids where there is a history of constipation.